My name is Dr. Ken Mills. I'm an internist and primary care physician here at St. Mary's Medical Center. I've been here since I graduated from medical school. I'm originally from Michigan, and I came out here for my internship and residency. I was chief resident here at St. Mary's Medical Center, and then was fortunate to stay on in practice here, taking on with a well-known internal medicine group, and have been in practice for the last 30 years. I treat patients generally above the age of 13, and am very interested in taking care of patients throughout their adult life. I enjoy sort of the longitudinal look at patients and in health prevention and care of chronic medical problems. I have a particular interest in patients, in geriatric patients, because certainly as patients get older, their chronic medical conditions come more to the forefront. But really, prevention and healthcare maintenance is a big part of what I do in my practice. Patients come to our office generally to establish themselves as a new patient. That's kind of the way I like to begin a relationship with patients, and in fact I chair an initiative here at St. Mary's, the Primary Care Initiative, kind of emphasizing the importance of the role of the primary care physician, whether they be an internist or a family practitioner. You know, again, as a primary care physician and really believing in the whole concept of healthcare maintenance and the medical home model, I feel very strongly that establishing that initial relationship is really important in one's healthcare journey. So I really want to make sure that the patient feels comfortable with me and that they're comfortable asking any questions they may have. I'm not particularly dictatorial in the way I handle patients and treatment decisions. I guess I would consider myself more of a negotiator of care. I want patients to buy into whatever I might recommend. I feel that unless a patient kind of buys into the treatment plan, it's probably not going to work. And you know, ultimately, if we may have an impasse, I oftentimes will offer out that, well, geez, you know, if I was in that situation, what would I do? And I think many patients are comfortable with that approach. I think, you know, if we look at the world, and you know, generally we look at the world through the glasses that we wear. And so if you're seeing a specialist, that specialist is really looking at you through their special interest, you know, the specialty that they've been trained in. The beauty of a primary care physician is that they're trained to look at you as the whole person. And to me, that's really important, because today's healthcare system is so complicated, so complex, that you need somebody on your side to navigate you through that system, and quite frankly, to protect you from some of the pitfalls of that system. So again, I'm a real believer in that, through using lots of terms these days, but the medical home model, the primary care physician. And I think we're going to see in the near future how important that is. And again, that's showing up in print media, in social media, and really just about everywhere that you look. Obviously, I'm going to be an advocate for St. Mary's. Again, I mentioned that I came here after medical school. I trained here, and I've stayed here my entire medical career. It is a different hospital. It's a faith-based organization, and I think no matter what your religious persuasion is, I think that a healthcare institution that's faith-based offers you something additional. It's an added value. I think St. Mary's is very much a home environment. The physicians, the nurses, the staff here have a long record of staying on the job and knowing each other well and getting along. Patient satisfaction is very high on the radar screen here. Again, it's a place that I'm very comfortable working. I've worked in other institutions in teaching positions and whatnot, but if I were to have the need for health care, I would come here. And in fact, I have come here.